Alright, so guys, it means a new video. I'm the MDC and MDCRX, and if you follow my page, you know that this week we're going to be talking about cough and cold or flu preparations. So basically what I'm going to do is go through like a little list of preparations that are out there and tell you exactly what they're for, so you know when to get what for what. So I'm just going to jump right into it, starting with elixirs. Now, normally if you see something ending with elixir like DPH elixir or histal elixir, it normally just has in the antihistamine. So it might just have in the DPH, and it will just treat things like your runny nose and that sneezing that you might be affected with. So these are basically just good for, as I said, sneezing, and they can actually be used for allergic reactions. So in a case where probably someone eats a little bit of peanut butter or something and they're allergic to peanuts, they can use the DPH elixir and it will actually clear up the allergic reaction if it's not too severe. And also if you're having a little itching due to a little allergic reaction, so probably like a cow itch or poison ivy, then you can also use this DPH elixir or histal elixir. Now moving on to the preparations for dry cough. So normally if you have a little dry cough and you notice there's nothing coming up, there's nothing productive, it's just a little irritation in your throat and that's causing you to cough, there's no sputum or any spit or mucus coming up, you'd want to go for the preparations with DM on them. Now the DM basically stands for this drug called dextromethorphan, but let's not talk about that right now. Basically the preparations with DM on them just suppress the coughing sensation, and what happens is you just stop coughing and the irritation will kind of naturally pass, so you wouldn't have to deal with that annoying irritating cough. Now we're going to move on to our expectorants. So for expectorants, these are for wet and productive coughs. For that whap. Yes, so expectorants are for productive coughs. So if you realize you're coughing and you hear that little, rustling or rumbling on your chest, and you feel like there's some cold coming up or mucus or something, and it's not coming up easily, then that's what you get the expectorants for. What they do normally is they just kind of the mucus and make it easier for you to bring up the mucus. So when you cough, the mucus comes up easier and you can get rid of whatever the mucus is trying to get out. Now we're going to move on to our decongestants. So a lot of these preparations with DC on them, some of them are over the counter, but some of them you do need a prescription to get. These preparations now are for when you're having, say, sneezing and there's a lot of congestion happening, so you can't breathe through your nose and so on. It's not all about the mucus, sometimes just having congestion and you need a decongestion to clear it up. Now let's talk about our lozenges. So lozenges you'd use in the case of a sore throat. It's basically medicated hard candy that you'd suck on and the medication will work on your throat. It's normally just some pain relieving medication and it will just relieve you of that pain and discomfort that you might be having in your throat. Last but not least, we're going to talk about our multi-symptom preparation. So we know about our Panadol multi-symptom, Cetamol multi-symptom, this, that multi-symptom. So as we know, multi-symptoms are exactly what it is called. It treats multiple symptoms. It treats the sneezing, the runny nose, the congestion, headache. It treats the general muscle aches and pains that you might have when it comes on to a flu. And it treats the fever. So in the case where you have more than one symptoms like that, then you definitely go and grab yourself a multi-symptom and you just take that and relieve yourself of those symptoms. However, the daytime preparations tend not to have antihistamines in there because that's what would make you sleep. So if you're getting a daytime multi-symptom, be sure to get a second generation antihistamine. Second generation means non-drowsy antihistamine, so get yourself a non-drowsy antihistamine to go with that daytime multi-symptom so you can treat the runny nose and sneezing if you have it with the other symptoms of fever, runny nose, cough, so on. Alright, so that's the preparations that I'm gonna go through for you guys today. Point to note though, for decongestions and multi-symptoms, they can cause a bit of issues in persons with hypertension, that's high blood pressure, or diabetes. So if you know you have any comorbidities, just talk to your pharmacist about any multi-symptom preparation that you're going to take. Or if you know someone that's interested in multi-symptom preparations and you know that they have hypertension or diabetes or something else wrong with them, tell them to make sure they talk to the pharmacist before buying it. Now remember, we are still in the COVID-19 pandemic though, so if you actually have flu-like symptoms, be sure to contact somebody over the phone and self-quarantine, please. Alright, I guess we can call this the end now. Thank you guys so much for watching. If you liked it, just drop a like. If you have any questions, comment them in the comment section or just DM me. I try to answer all the questions that I'm posting in the comments and DMs. And I'd love if you guys could share this because I love you guys do that each week. It helps so much. Thank you so much for that each week. Thank you for coming this week, and I hope to see you next week again.